Just because you're going through menopause doesn't mean you have to deal with leaking or peeing your pants when you don't want to, constipation, farting when you don't want to be, maybe making vaginal noises slash queefing when you don't want to be. So much of those are attributed to the pelvic floor. And I get asked all the time, how do I keep my pelvic floor healthy during menopause or as I'm going through menopause or even after menopause? The secret is going to be exposed in this video. We can all have healthy pelvic floors, and it just takes a little bit of knowledge about how to keep your pelvic floor healthy. The fact of the matter is, most of us go through our lives not really being connected to our pelvic floors. And so when it comes to when they start having problems with like peeing our pants or farting when we don't want to be, or when sex starts to become painful, then that's when we start to pay attention. Unfortunately, there's probably been maybe some issues that started really a lot earlier than menopause that could have been addressed. And this starts, some of our patterns of our pelvic floor start having dysfunctional patterns like from when we're toddlers and start to potty train, or even through our high school years. And the reason for that is that the pelvic floor is 3 layers of muscles, fascia, lymphatic system, nerves, blood vessels, okay? And this is a pelvic floor. The pelvic floor is supposed to do these things. It's supposed to contract, it's supposed to relax, and it's supposed to overstretch. So how do you keep this thing healthy so you can be healthy and not worry about these embarrassing things that can happen, or not be plagued even with like low back pain and chronic hip pain? So much of that actually comes from our pelvic floor, and you don't want to have to deal with that. We want to keep you healthy through menopause. So please like and subscribe to this video. I know it might be a little tacky to even ask that, but we do this all for free, and I would just love to be able to get this to more people. So the more you like and subscribe to us, the more that we can put out this content and get it to the people that deserve to hear it, which is all women aging in America and in the entire world, because we all go through menopause. And menopause is a time period where we start to lose our estrogen and our hormones go a little crazy. And that affects all the muscles of our body, including our pelvic floor. The problem when it affects our pelvic floor is then we start dealing with things like peeing our pants and painful intimacy. And that's just not fun. We don't want to lose the ability to not feel pleasure. So I want you to start to think about the pelvic floor and connect to it. And I'm going to teach you exactly how to do that. And as I teach you to do that, this is the tool that can be used to help keep the pelvic floor healthy. I'm Dr. Allison Felt. I'm a pelvic expert physical therapist. And so I help women keep their bodies really healthy and keep their pelvic floors in tip-top shape so that they don't end up with like surgeries or having to get Botox in their bladder or getting bladder surgeries. We avoid all those things, and we do that through pelvic floor physical therapy. And the tools I am going to give you today is what I give to my patients and what I've been giving to my patients for the last 15 years. So let's get started. And if you just start to implement this very first tool, you're already going to see improvement in your pelvic floor control. So the deal is, a lot of times we don't have this connection. So we have to establish the connection to the pelvic floor. And so let's get your brain connected to your pelvic floor right now. We're going to do this tip together. All right, this is our pelvic floor. Like I mentioned earlier, 3 holes go through pelvic floor. All right, so when we take what's called a diaphragmatic breath, this is often the type of breath that's used in like a yoga practice. When we do this type of breath, what happens is we get our pelvic floor to open and relax. Now, before I even get started, everyone's gonna say, but I need my pelvic floor tighter. I gotta do the kegels. I've been doing the kegels for 15, 20 years. No. Kegels, ineffective. Every single person I see in my clinic, ineffective. Kegels aren't being used appropriately. And when you're actually ready to do them, your body's already doing them throughout the day. You don't need to implement them into some routine. Okay? It's like you telling me you want to get fit and lose weight and all I'm giving you is bicep curls. Okay? That doesn't help the whole like get fit and lose weight problem. Okay? It's just one simple silly exercise. And most of the time if you do it too much, it just gets tighter and doesn't have as much movement. And so that's what happens with the pelvic floor. If we are just working on contracting our pelvic floor but we don't have the full movement of the muscle, it becomes weak and it becomes ineffective. And through menopause, that can be exacerbated because we don't have our hormones that help bring more blood flow to the tissue of the pelvic floor and the pelvic organs. We stop menstruating. Usually menopause, you're not in menopause until you haven't had a cycle for 12 months. So you have not menstruated for 12 months. Now, some people will make that like almost 11 months, and then they have to like start their countdown again. And I get that's super frustrating. But when we are menstruating and we're going through that menopause process, what is happening is that the tissue is changing. So it's not getting as much blood flow. People lose a lot of lubrication. The skin often feels tighter, and it just isn't as healthy. So this tool is going to help keep you really healthy. And it's called diaphragmatic breathing with pelvic floor opening. It's that simple. Let's do it together. The diaphragm lives under the rib cage. Okay, so as I inhale into my belly, deep breath in, exhale, let it go. As I'm doing this breathing, inhale in, exhale, let it go. What I need to do is I need to also be opening my pelvic floor. So as I inhale and open and the diaphragm opens, then the pelvic floor opens. You have to make this mental connection. So I need you to mentally focus and bring your attention down to your pelvic floor and feel that opening. Almost as if you feel like you were going to fart, but you're not pushing a fart out. It's just a little connection where you feel the muscle opening, and then exhale, you get this natural recoil. We want to get that pattern of this muscle control cemented in your body. Because if we can work on that opening, all of a sudden you're going to get more range of motion. Why do we care about this? The more range we can get of this muscle, the more blood flow can pump to this muscle. It is a juicy, magical thing that happens. It makes sex better. It makes incontinence better. It will help improve your life. And it will keep you pain-free. Because what happens with our pelvic floor is if we have this range of motion, which we should have and we need to work into, then every time our foot hits the ground, we get this natural recoil. So every time my foot hits the ground, I get a recoil. My pelvic floor, the bottom of the core, is absorbing the shock and taking the pressure off of my joints and also protecting my bladder and my organs. And so it's a double whammy, and it's easy to do during menopause. Just implement this breathing, and this will make everything better. Now, also adding in some manual pelvic floor physical therapy is an absolute game changer to your menopause experience, and every single person needs to experience what true healing of the pelvic floor is and what true manual pelvic floor work is. It is intravaginal work, and it is magical because it helps give you this range of motion of the pelvis, of the actual pelvic floor muscles, and it helps open up and unlock the hip joints and unlock the low back. So we have people that come from all over the world to fly here for weeks at a time to get what we call intensives, where they'll do like 3 or 4 days of treatment to help unlock the pelvic floor and give them all this new blood flow and give them all this new range of motion, and their back stiffness goes away, their hip pain goes away, and it's a beautiful thing, and sex gets a lot better. And so we use these tools, but if you don't have access to that and you don't have access to coming to see us here in clinic, then I highly suggest that you work on this breath pattern in order to start opening up and giving you new range of your pelvic floor. When we do this opening, you might be like, well, I'm scared I'm going to pee. The reality is that if you're so tight and the pelvic floor is so constricted without blood flow, then that's actually squeezing on the urethra, it's squeezing on the bladder, and the bladder doesn't have room to sit in the pelvic floor, and that's actually when you start to pee. I know it sounds complicated, but the reality is just get this range of motion and start working on this range of motion, and you will find serious improvements in your life. The other thing I need you to know is that if you're doing kegels, cut them out. If you're sitting on an emsella, cut it out. You don't need that. That's not the range of motion that helps give you bladder control and that helps keep the pelvic floor healthy. So avoid that, because in our moms and grandmas have done that for years, right? And they've all peed their pants or had bladder surgeries or were in their 80s and had diapers, and kegels didn't work for them. There's a reason for that, and we know better now. So don't subscribe to those programs. You want to subscribe to getting this full range of motion of the pelvic floor and just start by breathing. That's the one tool that you can use right now to help your menopause experience. I really truly hope you found this video valuable. Please like and subscribe, share with all your friends, and we release content every two videos a week. Yeah, I just have a serious mission to help women age in America with grace, and really all over the world, with grace and avoiding hip replacements, knee replacements, bladder surgeries. I'm on this journey myself. I want to avoid all these things as well, and this is what we've helped thousands and thousands of people to do in my clinics, and so I'm here to share this with you across the world. Take care. I'm Dr. Allison Felt. Thank you so much for joining me.